We're tuned into Recovery TV, the voice of hope, with your host, John J. Tassoni Jr. Discussions and information on addiction and mental health issues. Here's your host, John J. Tassoni Jr., with today's guest.
Welcome to another edition of Recovery TV, and I'm your host, John Tassoni. Narcan, please get it. CVS, URI, Walgreens, wherever it's sold or given away, please get it. Keep it in your purse, put it in your car, take it out of your car at night because it's weather protected. We need it. It saves lives. My guest today is Dr. Chris Aniano, and he's the medical director for Neighborhood Healthcare Plan in Smithfield. Welcome, Doc, and thank you for joining us today.
Pleasure to be back. Thank you.
So let's talk a little bit about Neighborhood now that you've got comfortable up there, and now you're the medical director, and tell us what's going on.
Well, I think, as a lot of people are probably familiar, and I know we always appreciate being invited back. Neighborhood's been in Rhode Island for 30 years, a homegrown company in the healthcare space, healthcare managed care organization for the state of Rhode Island. And in 30 years, we've had a lot of Rhode Islanders trust us with managing their care, and that's in the Medicaid space, the Medicare space, the dual eligibles, people who can get Medicaid and Medicare, and in the commercial space. And we're very, very proud of that fact. 30 years is quite an accomplishment, and much more to accomplish as we try to maintain a fantastic record of being named one of the best MMP or dual eligible care plans in the country. Yeah. So we're very excited, and a lot more to come from Neighborhood.
Let's talk about March. March is Nutrition Month.
It is.
There's a lot of children that are not getting breakfast, they're not getting the availability of good nutrition.
Yeah.
There's been bills in the General Assembly to stop paying for the breakfast portion and try to help with lunches with kids. Yeah. What is Neighborhood doing?
Well, I think really important to us when we talk about nutrition, especially, we think about coming here to Recovery TV and talking a lot about behavioral health. Of course, nutrition is important in our healthcare population because of the prominence of obesity. We all need some better nutrition, some better guidance, some better decision making, some better guidance on how to control and make sure that we eat healthy things, but particularly for behavioral health. There have been studies. One most recently in 2019 that showed there's a real link between better nutrition, the consumption of more clean proteins, fruits, vegetables, and improvements in behavioral health issues, including anxiety, depression. It's not the whole answer, but it's part of the answer.
Puzzle.
And that's what made us think that was something important to mention about March being Nutrition Month.
Well, the other thing too is, there's been a lot of recalls with a lot of different, whether it be the red dye, whether it be food that's tainted with something. You look at other countries and you look at their produce, they're not having the same problems that we're having. You know what I mean? It's something that the CDC and the rest of the folks need to take a look at. These pesticides we're using, everything is combined. It's almost like a perfect storm.
And at times there's confusion. I mean, I think, and that's a confusion that everyone shares. We say eat, proteins like, chicken or fish, but it's also about how they're prepared.
Right.
And so where there's confusion, Neighborhood tries to make sure that we add some clarity, that we help our members to understand. And one resource that we've been talking a lot about is the myplate.gov website. A very simple, clean resource for people to just get a sense of what really is a protein, what really is fruits and vegetables, and how to consume them, because it's not all the same, and you do have to be careful about how things are prepared. The other thing that Neighborhood is definitely doing is making nutrition an important part of our members' health care. Maybe we don't always think about it that way, but we should.
Right.
Nutrition is part of your health care. So in our MMP population, the dual eligible population, or the integrity line of business that we have, and we're the only one in the state that has that program, we've recently introduced a $75 a month gift card for food. So we make sure that our seniors and our dual eligible population that are some of the most at-risk Rhode Islanders from a perspective of their health have access to healthy fruits and vegetables. And that's on top of coupons that are also available for better savings through the MMP or dual eligible program.
You know, as we know it, you give somebody a $75 gift card. How do you track to make sure that they're buying the fruits and vegetables and not going to buying other things that they're not supposed to be buying?
Well, these are triggered in certain ways, you know,
Okay.
so that it's only, you know, for use in certain areas.
Yep.
But it is a very critical piece of healthcare, especially in the senior population. With inflation and everything that's been happening, you know, not to make light of it, but you know, you go to the grocery store nowadays, and the checkout line is a little scary with what things cost, especially when you're trying to get fresh fruits and vegetables and healthy proteins, meats, chicken, etc. And so we are hoping that this gift card, in addition to the coupons, helps our senior population and those with chronic health conditions to have better access to what they need.
Another problem I want to talk to you about is, probably me and you don't have it, stress. There's a lot of stress going on,
Yeah.
whether it's political stress, whether it's
Yeah.
work stress, whether it's children's stress. There's a lot of stress. I mean, I was in a hospital visiting a patient last night. The line was out the door. You know, everybody has to check in. And it was getting very tense with some people, like the matter of just like a second. Somebody's not thinking rationally and they're going off, but you could see it. It's like everywhere now. The stress level is like beyond belief.
Yeah.
How do we take care of that? Now that you know you're the medical director, so I come to you and say, Doc, you know, I'm like all stressed out. How do I fix it?
Well, I think that in answering that question, I think it's important that we talk about integrated care. Integrated care, when you hear that word, it sounds like, you know, what does that really mean? It means bringing together behavioral health care along with medical health care to address the fact that anxiety, depression, or some of the more significant behavioral health issues, bipolar or other psychiatric illnesses, are a part of our regular health care. And how do we handle that? Well, we started the show by talking about nutrition, one component, some better nutrition. But let's not forget all the other variables that can be in that. Quality sleep, getting away from social media or off your phone for a little while, maybe some meditation. Don't discount the importance of some exercise in your life. It doesn't have to be super rigorous, but it's got to be something that can help with some exercise. These are all ways of decreasing stress. And then if that's a part of your life and there's still more need for help, Neighborhood wants to make sure you have integrated care, access to a behavioral health professional, someone who can work with your primary care doctor to help you, and also Neighborhood Health has care managers. And so remember, and I know you were going to put our phone number up there on the screen, the 1-800-963-1001, to get to our member services team so that we can help you get a care manager. Or maybe you need a primary care doctor, or maybe you're looking for a behavioral health provider. Any of those things, we want to be there to help you get access so that we literally go all the way through this, from nutrition to lifestyle issues to care managers to providers, whatever our members need when they need it.
All right, Doc, we're going to take a quick break because I need it. Take a break. You're watching Recovery TV, and I'm your host, John Tassoni, with Dr. Aniano from Neighborhood Healthcare Plan, right after these messages.
And now, back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni, Dr. Chris Aniano of Neighborhood Healthcare Plan. is in the house, and Dr. Arnold is the head of, what are you the head of now?
Well, I'm the medical director at
right.
Neighborhood Health Plan.
Okay.
And we are still very, very proud to say after 30 years as a homegrown company in Rhode Island, still leading the way with the most amount of members in our managed care organization, and really looking forward to even brighter things ahead.
You know, I can't keep up with you, Doc. You're all over the place, like a tennis match.
1 in 5 Rhode Islanders are insured by Neighborhood Health Plan.
You know, I want to talk a little bit about care managers. You keep mentioning that over and over and over. What basically is a care manager?
It's a great point. I think the best way to say it is it's a resource. It could be a resource that you come out and ask for, and I'd call it an underutilized resource. A lot of our members, if you're in need of someone to help organize your care, whether it's therapy that you know you need, or you've worked through our member services team and you've got a new primary and you have an issue that you need some help coordinating care, that's what the care managers do. They're a resource to help you move through the healthcare system. Sometimes they may reach out to you. And let's say you're going through a tough time in life and maybe you were seen in the emergency room for a substance use disorder, an issue with alcohol or some other substance use disorder problem. They may reach out to you and say, hey, Chris, we saw that you were in the emergency room for this. Can we help you? Would you like a referral?
Well, you know, that's a great point because there's so many barriers now.
Yeah.
There's so many hoops you have to jump through.
Yeah.
So many people you're on the phone with. There was one particular individual, she had to explain herself to 12 different care managers at a particular facility. I'm not going to mention the facility, but imagine how frustrating you are if you have to explain your issue to 12 people, but the same issue.
Over and over. And remember that a care manager is going to know how to maneuver to get access a little better than you may, rather than you having to call for a certain therapy or situation. Right. They can make that call for you. They can make a referral. They can give either a treatment facility or a hospital or someone the heads up that you're coming or that you need to be seen. So care managers definitely an important part of, again, going back to that word, integrated healthcare, where all your needs are being met together, behavioral and medical, and coordinated well, so it's efficient.
Well, see, that's the key, coordination. If you don't have coordination, then you're all over the place.
Yeah.
You know, you'll be like a pool table. You'll be bouncing off every corner.
Yes.
And you're not going to be able to get it in the home pocket like you're supposed to be getting it in the home pocket. You know, I hear so many stories of that where people in my residential programs, when they get out, they get a referral, and then, well, John, I haven't heard from anybody in a week.
I haven't heard, yes.
I haven't heard.
Yeah.
At least you guys are looking at the point of putting everything together and circling the wagon and making sure that Chris sees this doc and then Chris goes to see this doc and you keep a coordinated care together.
Yeah, definitely an underutilized resource. And with all of the issues we have around our phones and communicating, you never know if someone who's texted you or called is real or not real.
Right, correct.
Developing a relationship with a care manager that you know and they know you, and you see that number and you go, that's my care manager. That's someone that can work for you.
You know what? You hit a great point because there's so many phone calls now with people that are just trying to get access to you instead of you getting access to them and following up with care because you don't know today. There's so many scams going on. There's so many people looking for your information. It's a scary time right now.
And that is, you know, recently our state had a breach based upon one of their vendors, and our state people are working so hard and getting that back online. It's probably a good time to mention that Health Source Rhode Island's website is back up and running, which is really fantastic. That website, with that working again, that's the place where Rhode Islanders can get on and purchase their health care, to purchase their health insurance through Health Source Rhode Island. So
Yeah,
it's great.
they do a great job about getting people health care.
Kudos to our state IT people for getting through that whole situation and getting that up and running.
No, I was by your facility the other day, and I noticed that it keeps growing. Keeps going. Brown Health is in there now.
Yeah.
The building next to it, it looks like there's more activity in there for medical. What are the plans for neighborhood, if you know them, about expansion?
I think that the best way to say it is we intend to be there working hand in hand with the entities in the state that we believe we're trusted collaborators with and stakeholders with, whether it's the Department of Health,
Right.
the Executive Office of Health and Human Services, whether it's the Office of the Health Insurance Commissioner, because remember, neighborhood participates in the Medicaid members' care through EOHHS. We're a part of the Medicare whenever it's dual eligible, which go right from CMS and the federal government, but also OHIC when it has to do with commercial. So the best way to put that is we're going to be wherever Rhode Islanders need health care management. And where we can, and certainly part of our mission and values over 30 years is really been geared particularly towards those that are most at risk. If you have something because of issues of equity in health care, because of your status in the state, or just your support, that you not having a lot of support around you, that's where we're going to be. To us, that's growth and is being there for more and more people.
I wanted to ask you this question because you hear it all over the place. Hospitals going out of business, potentially filing for Chapter 11. Where do you see the healthcare system? I mean, if you ask me, I say it's broke. The system as a whole. Where do you see the system in like 4 or 5 years?
Well, I think rather than saying broken, I'm going to say it's ailing. We have
some
some
life support.
Yeah, we have some things that certainly we all need to be a part of healing. We have issues, particularly of access. There's a very notable problem with just finding a primary care physician. Our primary care doctors in the state are busy. We're having trouble having enough primary care doctors to meet all the needs. And a lot of data that's out there would suggest that trend is not reversing right now.
Right.
So we need to find ways, and neighborhood fully intends to be a part of that process of thinking and trying to solve for how we attract more primary care doctors in the state, whether it's physicians, nurse practitioners, physician assistants, all the ways that we can make sure, because a robust network, that's one of the things we're very proud of. We need a robust network, not only of medical providers, but behavioral health providers who are all ready, because access, if you can't get the access to the care, people begin to slip.
I have to get access right now for commercials so I can pay the
understand.
bills. You're watching Recovery TV, and I'm your host, John Tassoni. We'll be right back with Dr. Aniano, from Neighborhood Healthcare.
And now, back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Dr. Chris Aniano from Neighborhood Healthcare Plan. Doc, thank you as always for joining us today. I greatly appreciate you coming on.
My pleasure.
So
Absolutely,
you want to talk
pleasure.
a little bit about a telephone number?
Well, definitely, I want to go back to starting with member services, or one of the strongest points, or one of the best resources when you're a member at Neighborhood Health Plan is being able to reach out to member services. And I think you were going to put the number up on the screen, but again, saying it, 1-800-963-1001, and that you'll see the way that works is that on that number is your access to whether it's pharmacy questions, care management that we alluded to, all sorts of ways to get better resources.
Again, Doc, I want to thank you for coming on today. You can call 9882 while we're at it. My guest next week is Sarah Hogan from AdCare. Thank you for joining us this week. If you see something, say something. Have a great week.